Well, hello and welcome back to the College of Natural Health Sciences Bermuda for the Functional Anatomy Induction Prep course. We are now at week number 10, which is the final week for this program. So hopefully you have enjoyed the course to this point, and we will go into our last chapter for this particular program. We are now at Chapter 9 of the Functional Anatomy textbook, and we will be looking at the leg, the ankle, and the foot. The learning objectives for today's lecture are: we're going to identify the main structures of the leg, ankle, and foot, including the bones, joints, special structures, and deep and superficial muscles. We're going to label and palpate the major surface landmarks of the leg, ankle, and foot. We're going to identify and demonstrate all actions of the leg, ankle, and foot, such as the movements that are available. And we're going to identify and demonstrate passive and resisted range of motion of the leg, ankle, and foot. We're going to draw, label, and palpate the deep and superficial muscles of the leg, ankle, and foot, and name their actions. And as always, palpation should include the origin, insertion, muscle belly, and demonstration of shortening and lengthening of the muscle. We're going to describe the function of each of the muscles of the leg, ankle, and foot. We're also going to identify both the synergist and antagonist involved in each movement of the leg, ankle, and foot, such as flexion and extension. We're going to identify movements and muscles involved in coordinated activities of the leg, ankle, and foot, such as running, walking, skating, and blading. We begin today's lecture by taking a look at the surface anatomy of the leg, ankle, and foot from an anterior view. Most superiorly, from the left-hand side, we see the head of the fibula, the lateral long bone of the leg. The peroneus longus originates on the proximal fibula and runs distally along its length. The extensor digitorum longus runs vertically from the tibia and fibula to extend the toes. The lateral malleolus is a lateral prominence on the distal fibula. Over to the right most superiorly, we see the tibialis anterior, which is a large superficial muscle which readily is visible on the anterior leg. We also see the gastrocnemius and the soleus muscles. The shaft of the tibia is the medial long bone of the leg. The medial malleolus is a medial prominence on the distal tibia. The tendon of anterior tibialis attaches on the medial sole of the foot. Now let's take a look at our surface anatomy of the leg, ankle, and foot from a lateral view. Beginning most superiorly from the left-hand side, we see the head of the fibula. The gastrocnemius is a two-headed calf muscle which is readily visible in the lateral view of the leg. The soleus is a large calf muscle that lies deep to the gastrocnemius. We can also see the tendon of peroneus longus, and we also see the Achilles tendon. Over to the right most superiorly, we see the extensor digitorum longus. We see the peroneus longus and the tibialis anterior. The four tendons of the extensor digitorum longus extend the middle and distal phalanges. Now let's continue to look at surface anatomy of the leg, ankle, and foot from a medial view. On the left-hand side, most superiorly, we see the shaft of the tibia. The tendon of extensor hallucis longus inserts on the great toe. And on the right-hand side, most superiorly, we see the medial head of the gastrocnemius. We also see the soleus. We see the Achilles tendon, the calcaneus, which is the bone of the heel, and we see the medial longitudinal arch, which is supported by ligaments and tendons. Continuing with our look at surface anatomy of the leg, ankle, and foot from a posterior view, over to the left we see the medial head of the gastrocnemius, the medial edge of the soleus, and the medial malleolus. Over to the right we see the lateral head of the gastrocnemius, we see the lateral edge of the soleus. The Achilles tendon is the convergence point for the three calf muscles which it attaches to the calcaneus. We see the lateral malleolus and we see the calcaneus. Now let's take a look at the bones of the leg, ankle, and foot from an anterior view. Beginning from the left-hand side most superiorly, we can see the lateral condyle of the tibia. We can also see the fibular head. The proximal tibiofibular joint is a stable synovial joint allowing little movement. We see the fibular shaft. We see the distal tibiofibular joint, which is a fibrous syndesmosis that allows very little motion, increasing stability of the lower leg. Now let's consider the bones of the leg, ankle, and foot from a posterior view. From the left most superiorly, we see the soleal line of the tibia, which marks the attachment of the soleus muscle. We also see the tibia. We see the medial malleolus. The subtalar joint is located distal to the talocrural joint and includes articulations between the talus and calcaneus. It works with the talcalcaneolavicular joint to allow inversion and eversion of the foot. We see the tarsal bones, which include the talus, the navicular, the cuneiforms. We also see the metatarsals. We see the proximal phalanx, the distal phalanx, and the middle phalanx. From the right-hand side, we can see the neck of the fibula. We can see the fibular shaft. We also see the lateral malleolus. We also see the talus, the calcaneus, the cuboid, which are the tarsal bones. Now let's look at the bones of the leg, ankle, and foot from a lateral view. The tarsal bones include the calcaneus, the talus, the navicular, the cuneiforms, and the cuboid. We see the talus, the body, the neck, and the head. We can also see the cuboid, the navicular, and we see the cuneiforms. Over to the left, we see the lateral tubercle of the talus. We see the attachment of the calcaneofibular ligament, and we also see the calcaneus. Also visible is the perineal tubercle, the tuberosity of the fifth metatarsal. We also see the phalanges. The metatarsals articulate with the tarsals and the phalanges. Now let's take a look at the bones of the leg, ankle, and foot from a medial view. Beginning from the right-hand side most superiorly, we see the metatarsals. We can also see the first proximal phalanx. We can also see the first distal phalanx. We can see the medial sesamoid bone. We see the medial cuneiform. We also see the navicular bone. And back to the medial top, we see the neck of the talus. We see the dome of the talus. Over to the right most superiorly, we see the talus, which articulates with the tibia and fibula superiorly. We see the tarsal tunnel, which is a passageway for tendons and nerves of the foot. and we also see the calcaneus and the talus, which bear most of the weight of the body. Now let's consider the bony landmarks that we can palpate on the leg, ankle, and foot. We can palpate the medial malleolus, the calcaneus, the medial tubercle of talus, the sustentaculum tali, the navicular, the cuneiforms, the lateral malleolus, the talus, the sinus tarsi, the cuboid, the peroneal tubercle, the base of the fifth metatarsal, the medial tubercle of calcaneus, the sesamoids, the metatarsal heads, and the phalanges. Now let's take a look at the ligaments of the ankle and foot from a lateral view. From the left most superiorly, we see the anterior talofibular ligament, which stabilizes the front of the ankle, preventing the talus from sliding forward on the tibia and fibula. The anterior tibiofibular ligament stabilizes the distal end of the leg, preventing displacement between the tibia and fibula. We see the posterior talofibular ligament, we see the calcaneofibular ligament, and we see the calcaneocuboid ligament. The long plantar ligament connects the calcaneus to the cuboid bone along the sole of the foot. The bifurcate ligament originates at the calcaneus, then splits to attach to the cuboid and navicular bones. We see the tarsometatarsal ligaments, and we also see the dorsal metatarsal ligaments. And once again, to the right most superiorly, we can see the talonavicular ligament. We also see the dorsal cuneiform ligaments, and we see the cuneo-metatarsal ligaments. Now let's take a look at the ligaments of the ankle and foot from an inferior view. Beginning from the left most superiorly, we see the plantar intermetatarsal ligaments, which connect the adjacent metatarsals. We also see the plantar cuneicuboid ligament. We see the plantar cubonavicular ligament. We see the short plantar ligament, which is deep to the long plantar ligament and connects the calcaneus to the cuboid bone. Over to the right most superiorly, we see the metatarsals. We see the plantar tarsal metatarsal ligaments, which connect the tarsals to the metatarsals. We also see the plantar cubonavicular ligaments, and we see the plantar calcaneonavicular spring ligament, and we also see the calcaneus. Now let's take a look at some of the special structures of the lower leg, ankle, and foot from an anterior view. Beginning most superiorly from the left, we see the deep lymph vessels. We see the popliteal nodes. We see the great saphenous vein. We see the posterior tibial node. We also see the peroneal artery, veins, and lymph vessels. We see the small saphenous vein and lymph nodes. We also see the posterior tibial artery, vein, and lymph vessels. Also, we see the great saphenous vein. And then over to the right most superiorly, we see the anterior tibial node. We also see the anterior tibial artery, vein, and lymph vessels. We see the dorsalis pedis artery. We also see the dorsalis pedis vein. We also see the lymph vessels, and we see the dorsal venous arch. Now let's continue to take a look at special structures of the leg, ankle, and foot from a posterior view. The popliteal artery is a continuation of the femoral artery of the thigh. Just inferior to the head of the fibula it branches into the anterior and posterior tibial arteries. We can see the popliteal artery and vein. We can also see the popliteal lymph nodes. We can see the small saphenous vein, and we can also see the common fibular peroneal nerve. Now let's take a look at the superficial muscles of the lower leg, ankle, and foot from an anterior view. Beginning from the left most superiorly, we see the peroneus longus. We can also see the tibialis anterior. We can see the peroneus brevis. We also see the extensor digitorum longus, and we also see the extensor hallucis longus. Over to the right, most superiorly, we see the gastrocnemius, and we also see the soleus. Now let's consider the superficial muscles of the lower leg, ankle, and foot from a lateral view. Beginning most superiorly from the left, we see the plantaris. We see the gastrocnemius. We see the soleus. We also see the peroneus longus, followed by the peroneus brevis. We can also see the abductor digiti minimi. Over to the right most superiorly, we see the tibialis anterior, followed by the extensor digitorum longus. We also see the peroneus tertius, and we also see the extensor hallucis longus. Now let's take a look at the superficial muscles of the lower leg, ankle, and foot from a medial view. Beginning from the left, most superiorly, we see the extensor hallucis longus tendon, and we also see the tibialis anterior tendon. And then back over to the right most superiorly, we see the gastrocnemius, we see the soleus muscle, we also see the flexor hallucis longus tendon, and we also see the flexor digitorum longus tendon, and then we see the tibialis posterior tendon. And now let's look at the superficial muscles of the lower leg, ankle, and foot from a posterior view. Beginning from the left most superiorly, we see the gastrocnemius medial head. We also see the Achilles tendon. Over to the right, most superiorly, we see the lateral head of the gastrocnemius. We can also see the soleus. We see the peroneus longus, as well as the peroneus brevis. Now let's consider the deep muscles of the lower leg, ankle, and foot from a posterior view. We see the popliteus muscle. We see the peroneus longus. Over to the left, we see the tibialis posterior, and just beneath, we see the flexor digitorum longus. Over to the right, we see the flexor hallucis longus. We also see the peroneus brevis. And now let's take a look at the muscles of the foot from the plantar view, which is the bottom of the foot. Beginning most superiorly from the left, we see the flexor digitorum longus tendons. We see the flexor digiti minimi brevis muscle. We also see the plantar interosseous muscle. We see the flexor digitorum brevis muscle. We see the abductor digiti minimi muscle. We can see the calcaneus bone. And then over to the right, we see the lumbrical muscles. We see the flexor hallucis brevis muscles. We see the flexor hallucis longus tendon. We see the abductor hallucis muscle. And we also see the plantar aponeurosis from a cut view. Now let's consider the general techniques for palpating muscles of the leg, ankle, and foot. We first locate the origin, followed by the insertion. Then we locate the muscle belly. We activate the muscle using resistance. We shorten the muscle, and we lengthen the muscle. And here we have illustrated the muscle attachments of the lower leg, ankle, and foot from an anterior view. The red indicates the muscle's origin. The blue indicates the muscle's insertion. And here we see the muscle attachments of the lower leg, ankle, and foot from a posterior view. And here we see illustrated the muscle attachments of the foot from the dorsal surface or from the top. And here we see the muscle attachments of the foot from the plantar surface or from the bottom of the foot. Now let's look at the motions that are available at the ankle. In illustration A, we see plantarflexion of the ankle. And in illustration B, we see dorsiflexion of the ankle. Now let's take a look at the motions that are available at the foot. In illustration A, we see inversion of the foot. Illustration B, we see eversion of the foot. In illustration C, we see toe flexion. In illustration D, we see toe extension. In illustration E, we see pronation of the foot. And in illustration F, we see supination of the foot. Now let's consider the purpose of passive and resisted range of motion of the leg, ankle, and foot. Passive range of motion helps to establish the health and function of inert structures such as the joint capsules and ligaments. It allows evaluation of relative movements between talocrural, subtalar, and distal joints. Resisted range of motion helps establish health and function of dynamic stabilizers and prime movers. It helps to identify balance and potential imbalance between muscles that stabilize and steer the lower extremity. And now let's look at passive range of motion of the ankle. Illustration A demonstrates passive plantar flexion of the ankle. Illustration B illustrates passive dorsiflexion of the ankle. And now let's look at passive range of motion of the foot. Illustration A demonstrates passive inversion. Illustration B demonstrates passive eversion. Illustration C demonstrates passive toe flexion. Illustration D demonstrates passive great toe flexion. Illustration E demonstrates passive toe extension. And illustration F demonstrates passive great toe extension. And now let's consider resisted range of motion of the ankle. Illustration A demonstrates resisted plantar flexion. Illustration B illustrates resisted dorsiflexion. And now let's consider resisted range of motion of the foot. Illustration A demonstrates resisted inversion. Illustration B demonstrates resisted eversion. Illustration C demonstrates resisted toe flexion. Illustration D demonstrates resisted great toe flexion. Illustration E illustrates resisted toe extension. And illustration F demonstrates resisted great toe extension. Now let's consider the coordinated movements of the leg, ankle, and foot, beginning with walking. Coordinated weight shifting from one leg to the other drives the walking pattern. The swinging leg moves through hip flexion, knee extension, ankle dorsiflexion, and toe extension. The stance leg drives the movement through hip extension, ankle plantar flexion, and toe flexion, especially with the big toe. Controlled pronation of the foot absorbs shock and accurately directs the forces across the foot. Running requires greater force production than walking. The major difference between walking and running is the presence of a flight phase. There is a time in the running cycle when both feet are off the ground. This requires greater concentric forces to propel the body off the ground and eccentric forces to catch the body upon landing. The same muscles, which are the hip extensors and ankle plantar flexors, drive the movement. Skateboarding requires a variety of powerful and fine movements of the ankle and foot. The gastrocnemius and soleus create jumping motions necessary to propel the body and board into the air. The peroneals evert the foot, and the tibialis anterior and posterior invert the foot to guide the position of the board and control the landings. Rollerblading and skiing are frontal plane movements that rely heavily on the medial and lateral muscles of the leg. The peroneals drive the pushing motion, which is eversion, along with the hip abductors. The tibialis anterior, the tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus work with the intrinsic muscles of the foot to maintain foot position during this movement. The hip adductors are also heavily recruited during this side-to-side motion. So we will now summarize the main points of today's lecture. The tibia and fibula of the leg create the proximal and distal tibiofibular joints. Both joints have very limited mobility, providing stability to the lower extremity. The ankle joint, or talocrural joint, allows only plantar flexion and dorsiflexion. The subtalar joint is more mobile and allows inversion and eversion of the foot. The foot is a complex network of bones, joints, and ligaments that allows several motions, including the surface adapting and shock absorbing motions, pronation and supination. Several extrinsic muscles move the ankle and foot simultaneously, while intrinsic muscles generate fine foot motions. Powerful motions of the ankle and foot are generated by large superficial muscles, including the soleus and gastrocnemius. Gait is a complex movement pattern of the entire body, but is driven by the lower extremity. The muscles of the leg, ankle, and foot work together to create functional movements such as walking, running, lifting, and skating. Okay, so our final assignment, assignment number 9 for week 10 of the induction prep course. We're going to list the bones of the leg, ankle, and foot. We're going to list the joints of the leg, ankle, and foot using the anatomical description. We're going to list the ligaments of the leg, ankle, and foot. We're going to list the bony landmarks of the leg, ankle, and foot. We're also going to list the muscles of the leg, ankle, and foot. We're going to describe the movements that are available at the leg, ankle, and foot. And we're going to describe which of all the functional anatomy topics you've taken so far in the induction prep course, you're going to say which one you found to be the most interesting and you're going to state your reasons why. Please place your answer to this question in the comments section beneath this video. And as always, my office hours are on Thursdays from 4 to 6 p.m. I look forward to receiving your assignments and reading your comments in the comments section. And also be on the lookout for the exit video for the IPC 300, the induction prep course. In that video, it will describe what you need to do as far as taking the final exam and completing the course evaluation. So please enjoy your week and do take care.